you?
Oh, today I'm quite good. Yes, I am studying um in National Hematology and Blood Transfusion in Hanoi. Oh, so I learned many
Are you
knowledge. Yes, so
yeah,
I'm happy. Mhm.
okay? Are you tired today, Doc?
Sorry.
Tired
Oh, Anita.
a little. Okay. So, um, I have something to ask you first. Is that
Yes,
okay?
yes.
Okay. So, what did you do today? What's your food today? Let's talk about that. What's your food today? Your
Oh, yes.
yes.
I had dinner. I had
Dinner.
dinner. Yeah.
Yes, that's very okay. So today, Doc, we're going to talk about eye abrasion. Oh, Doc,
Yeah.
we're going to talk about eye abrasion today. Are you ready?
Oh, yes.
Yes, okay. Let's start our lesson now. Okay. Tell me, can you see my screen?
Yes.
Okay, let me check. Please wait.
Yes.
Hmm, this one. Ta-dam, ta-da. Okay, here we go. Oh, it's not sharing. Oh, Doc. Oh no. Okay, Doc.
Yeah.
Yes, I'm really sorry. Zoom is broken. Let's just continue, okay?
Oh, yes.
I'm really sorry.
Okay. Okay.
It's Let's start our lesson now. Let me see. Okay, here. Okay, let's watch the video now.
Yeah.
This one. Okay. I'm sorry. Let me share my screen. Okay, this one. So let us watch a video. Okay, this one. Let me explain first this one in Vietnamese. Vietnamese. Let me check. Vietnamese. Here. Doc, my Zoom keeps on updating. I am really sorry. I am really sorry. Okay, so let us start now. Our first lesson is all about this one, abrasions. Okay, let us watch now.
Eye injury. Right. I see that you're here about an eye injury. Can you
Doc,
tell
can
me
you
what
hear it?
happened?
Yeah.
Well, I was looking after my grandson. I'm afraid he's quite a handful. We were on the floor playing with his toy truck, and my grandson accidentally kicked me in the eye.
Right. When was this?
It was about 2 hours ago.
Yes, I can see that it looks quite red and irritated. How does your eye feel now?
It's extremely painful. My eye keeps watering, and I've got blurred vision too.
Okay. Have you got any sensitivity to light?
Yes, I can't stand any bright light at the moment. Being outside in the sunlight hurts my eyes a lot.
Have you seen any flashing lights at all?
No,
What about floaters?
I'm not sure I understand what you mean by that.
Floaters in the eye can look like black flecks or bits of spiderweb in your vision, particularly if you look at a white wall.
Oh, right. No, I haven't ever noticed anything like that.
Any discharge from your eye?
I haven't got any discharge like pus, but my eye is watering a lot. And it feels like there's something in my eye as well. It's quite irritating.
Okay, I see. Can you tell me about your past eye history? Have you had any problems with your eyes in the past?
Well, I had cataract surgery on both eyes 3 years ago. That's made a big difference to my vision.
Okay. Any other eye conditions?
No, nothing at all.
Do you wear contact lenses?
No, I've never liked the thought of putting anything in my eye. I prefer to use glasses, which I only need for reading.
Okay. From what you've told me about the injury, and after examining your eye, I can tell you that you have a corneal abrasion, or a scratch, to the front part of the eye.
That sounds very serious. I won't go blind, will I?
No, you won't go blind, and treatment of the condition is quite straightforward if there's no foreign body left in the eye. When I looked at your eye, I couldn't see anything like tiny bits of metal or plastic, so it's just the abrasion or graze on your cornea that's causing the problem.
Well, it certainly hurts a lot.
Corneal abrasions can be very painful because of the large nerve supply to that area of the eye. I'll prescribe some pain-relieving eye drops to bring down the swelling in your eye and make it more comfortable. You can also use some lubricant drops to help stop your eyelid from sticking to the cornea.
What about antibiotic drops? Shouldn't I have some of those in case I get an eye infection?
No, there's a low risk of infection following mild eye trauma, so antibiotic drops are not considered necessary as a preventative measure. However, if your eye becomes increasingly red or painful, or you develop blurred vision, you should get emergency eye care immediately.
Okay. Do I have to wear an iPad?
No. These days it's not recommended that you cover your eye with a pad or eye shield because it may reduce the amount of oxygen that reaches the cornea. It may even slow the time it takes your eye.
Better.
The cornea usually heals in 24 to 48 hours. While your eye is healing, try to avoid touching or rubbing it. You may still need to continue wearing sunglasses when you go outside, as your eye will be sensitive to light until it heals completely.
Okay, doctor. I'll do that.
Oh,
I'm having a hysterectomy tomorrow, but I don't really know much about it.
That's okay. I'll go through it with you now.
okay. So let's have the questions, Doc.
Yeah.
Okay, let's have the questions. Here, I made a reviewer for you. The very first question is this one. What are this one? Control V. Okay, here.
Các nguyên nhân phổ biến của sự mài mòn giác mạc là gì?
I know a few caution of cognitive abrasion. The first injury.
Injury.
Yeah.
Injury.
The second short-sighted condition.
Okay. So is it okay? Thank you very much for your answer, Doc. Now let us go to this one. This is a little bit of an interesting question. Here.
Những phơi nhiễm môi trường nào nên được xem xét khi đánh giá có thể mài mòn giác mạc?
I think variation, temperature, solution of pollution.
Oh, pollution.
Yes. Environment pollution.
Oh, pollution. Yes. Like, the air.
Yeah. And air.
Yes, the air. Okay.
It comes to chemistry.
How about the sun? How about the sun, though?
Yeah. Sun is physical factors.
Oh, is it dangerous to be exposed in the sun?
Yes. Yes.
Ooh.
Sun and some blue side. It's not, because it can damage our view and cause cognitive aberration.
Oh, okay. So is it dangerous, Doc?
Yes. The blue side from the phone, the laptop and computer and some telegram, some electronic instrument.
Oh, okay.
Damage our eye, our vision.
Oh, okay. So thank you very much for that answer, Doc. Let's go to the next question. Let's go here. Okay, for our next question is that why is it okay here? This one here. Let me read the question. Why is it important to ask about prior eye surgeries or conditions?
Oh, surgeries, eye surgeries, cause to injure cognitive. So one of the condition, complication of surgery is a cognitive aberration.
Oh, so it is there is an abrasion if there is a surgery. It is possible to have abrasion because of surgery.
Injury, some surgery it's a complication.
A complication. Okay.
Complication, yeah.
Complication.
Surgery.
Complication. Okay, thank you very much, Doc. Now we have the next question. This one. Okay, here we go. Oh, this one. I'll just read the English. How does a corneal abrasion differ from other causes of eye pain, such as conjunctivitis and keratitis?
Oh, now the should treated conjunctivitis and keratitis early.
Early.
Early and completely.
Oh, okay.
Yeah.
Wow.
Rate of complication. Rate of complication of conjunctivitis and eye infection is a cognitive aberration.
Okay. So, which one is worse, Doc? Is it conjunctivitis or keratitis?
Conjunctivitis is infection in
Infection.
eye. Infection in eye.
Oh.
Some virus or some bacteria could cause conjunctivitis and keratitis. Yes. And some allergic condition. Allergic factor also cause conjunctivitis. Yeah.
Oh, okay. Thank you. Oh, okay. Thank you for that information, Doc. Now, this is a little bit of a more interesting question. Yeah, let me share it to you. The question is, why do patients with corneal abrasions often experience photophobia?
Photophobia. I don't
Mm.
know about means photophobia.
Photophobia is fear of light.
Oh. Because photophobia is when our cornea is damaged. The light and can't go straight
Mhm.
through the cornea can't go straight to cornea and
So,
and the person often can't see clearly.
oh,
Yes.
oh, okay.
So they put them
Yes,
few
okay, Doc.
few
Okay.
yes. Glare, few glare,
Blurred.
yeah,
Blurred. This
Blurred.
one, Doc. Blurred.
yes, blurred
Oh,
and
blurred.
glare,
Blurred. Yes.
glare.
Yeah, it's blurred.
Yeah. So uh, the person often feel take the photophobia.
Yes, because they sometimes see it as blurred. Okay. Thank you very much for that, Doc. Now let's go to this one. What are the possible complications of an untreated corneal abrasion? Let me put it here. This one here.
Oh,
What?
some complication of untreated corneal abrasion is lost of vision.
Oh,
Vision can't see uh thing everything clearly and
oh,
and the and come and this condition has yes blindness
blindness.
yes and recue can't recue
Oh, okay.
can't recover
Recover. Okay. So,
blindness that can't recover.
okay. Oh, okay. So when they can't recover, they cannot recover, it may lead to blindness.
Blindness. Blindness.
Yes,
So
it,
all person can replace copy.
oh, okay. Wow, that's a little bit dangerous. It's really dangerous. Okay. Here, we have how can you differentiate between, oh, I will make this big doc so you can follow me with the question for a while, please. Oh, this one. How can you differentiate between a superficial corneal abrasion and a more serious corneal, this one? Oh, no, this is not the question. Control C, this one. This one. How can you differentiate between a superficial corneal abrasion
Oh,
and a
yeah. The corneal abrasion can lead to corneal ulcer. Ulcer is
oh,
more dangerous than abrasion.
oh, okay. So corneal ulcer is caused by what
By
though?
by demos cognitive aggression.
Oh, wow. Okay. So let us go. Thank you for that answer, Doc. Now let's go to physical examination. Let me show you the 11th question. We have lots of questions for this topic. This one, what are the key steps in performing an eye examination for a suspected corneal abrasion?
The person needs to clinic for eye clinic. The doctor will have a some test to he can he can use drug eye solution drug.
Oh, eye solution drug.
Yes, and he yes, and he will check the cognitive obsession.
Oh, okay.
And check and evaluate whether or not is new abrasion.
So, do they really have to go to an eye clinic? Doc?
Yes.
Do they have to go to an eye clinic?
No. It's easy because many have many optical clinic in Hanoi.
Oh, okay.
Yeah.
So they will go to different eye clinics.
Yes.
Okay.
And but the patient should go to the hospital for eye hospital.
Oh, okay. Thank you very much, Doc, for that. Okay, so do you have lots of eye clinic there in Hanoi?
Yes, I sometimes I have checking my eyes.
Oh,
In eye hospital. I have two dearest friends who work in eye hospital, Hanoi Eye Hospital and National Eye Hospital.
okay. So that is very interesting. Now let's go first, Doc, here. I'm going to share something to you first. This is the slit lamp examination. This one, Doc. Let me slit lamp examination.
Yeah.
Yes. Okay. Slit lamp examination. I will read first. It is a detailed eye exam that allows eye clinicians to assess the anterior and posterior segments of the eye. Under high magnification and illumination, it is commonly used by ophthalmologists, like eye doctors.
Ophthalmologists.
Yes, and optometrists.
Ophthalmologists.
Yes, to diagnose a wide range of eye conditions, including corneal abrasion, cataracts, glaucoma, and retinal diseases.
Oh, it's
Yeah.
retinal disease, glaucoma, cataracts, corneal abrasion.
And retinal diseases. Okay. So I have a question regarding it, Doc. Okay. Let me ask you the question. What findings might you observe? Let me share my screen so you will see the question as well. Okay. The question is what findings you might observe on a slit lamp examination? For a while, please. Okay, this is the question.
I am not a ophthalmologist, so I can't observe. I can't observe result on sleep examination. I am a patient. I am a
Oh, okay.
patient.
Okay, Doc.
I'm not
It's
an
okay.
ophthalmologist.
Oh, okay. It's okay, Doc. I'll just go here. Where are our questions here? Okay. I'll just go to this part, differential diagnosis and management. The question and number 1, I will show it to you, Doc. This one here. What are some conditions that can mimic a corneal abrasion?
I think it's hard for me to reply this question because this is about ophthalmology. So I am a internal. So I can't exam the person with cognitive disease and retinal disease.
Oh, okay. Okay, Doc. So we can thank you very much for your previous answers. Thank you. We can go now to the next topic since the questions are already answered. Okay, let me translate that to Vietnamese. Thank you for the previous answers. We can now go to the next topic. Okay, this one. Okay, so let us go there. Okay, our next topic is all about head injury. Head,
Head
yeah, yes, head injury. Let me share to you the this one, the video. This one, let me show you. Okay, here's the video.
Hi, I'm Dr. Webster. I'm one of the doctors in the emergency department. I'd like to ask you a few questions about your head injury before I examine you. Is that all right with you?
Yeah. It's okay.
Could you tell me how long ago the injury happened?
It was about 2 hours ago.
And how did the injury occur?
I was painting my house and fell off my ladder. Fortunately, I didn't fall from a great height.
Okay. Did you lose consciousness for any time after you fell?
I don't think so. I was on my own at the time, so I can't be sure.
Okay. What about any vomiting?
No. I haven't vomited at all.
Have you had any headaches or neck pain?
Yes. I've got a headache now, but it's not too serious.
Right. Have you experienced any visual disturbances? Like blurred vision, for example?
No. I haven't had anything like that.
I'd like to ask some questions about your general health now. Do you have any medical conditions?
No. I don't have any medical conditions.
Are you taking any medication at the moment?
No. I don't take any medication, apart from occasionally taking paracetamol for a headache.
What about recent alcohol intake?
I had 2 glasses of wine with my dinner last night.
Thank you for that information. I'll explain what will happen now. I'll do a physical examination and some neurological observations to rule out any skull or neck trauma. If everything is okay, you should be able to go home.
That's good.
If you are fit to be discharged, you should be accompanied home with a responsible adult. The person should stay with you for 24 hours while you rest.
Is that really necessary?
Yes. It is. The person who stays with you needs to watch for symptoms such as persistent headache, vomiting or vision problems.
I see. How long will it take to recover?
It usually takes about 2 weeks to recover. You may have a mild headache, some dizziness, and poor concentration during this time. Take paracetamol for the headache, but if the symptoms persist, you should see your usual doctor.
Okay. I'll do that.
Oh, okay, it's done. Okay, okay, it's finished now. Now, head injury is very dangerous.
Yeah.
Yeah, it is very dangerous. It might be bleeding inside. Wow.
Oh.
Yeah.
Oh, accident, car accident,
Yes.
motorbike accident. There are many motorbike accident in Hanoi. So it's popular, the most popular person that lead to head accident, head injury in Vietnam.
Oh, that's so dangerous and sad because usually it's because of this one, negligence.
Yes.
Yes, and we have the so-called reckless driving. Yeah,
Yes.
yeah, okay. So
Yes,
for the yeah,
and alcohol.
yes, alcohol, drunkenness. Okay, let's answer this question. What are the most common causes of head injury?
Oh, motorbike accident. Use alcohol. When driving.
Okay.
Before driving. Use use motorbike hat. Motorbike hat.
Oh, we call
Don't
that
use motorbike hat. Yeah.
helmet.
Helmet. Yes.
Mm,
Helmet.
helmet.
And many population in many people in Vietnam use motorbike, not car. Yes.
Oh.
So the rate of motorbike accident is and head injury is high, very high, very high in Vietnam.
Wow. That's why we really need to wear helmet.
Yeah, helmet.
Yes, helmet. Okay, let's now go to this one. Why is it important? Let me just share to you the second question. This one. Okay. What is it? Why is it important to ask about the mechanism of injury, like the fall, assault?
Because the caution of and mechanism of injuries lead to more dangerous or not of head injury.
Yes,
Besides the dangerosity and the dangerous
dangerous. Okay.
of
And sometimes it may lead to death.
yes to that.
Yes, to death. Okay. Especially this one, Doc. I know you know this one. We call it internal bleeding.
Oh yes, is it a head? Is it a is dangerous if it's bleeding?
Yes, there is a bleeding inside. Okay, now we can go to here. What detail you should obtain about a patient's loss of consciousness? Okay, this one. What details should you obtain about a patient's loss of consciousness?
Oh, if the person with the loss of conscious the person could have internal bleeding after brain injury. traumatic injury.
Okay.
Yes, the loss of consciousness, dangerous symptom of bleeding, of internal bleeding.
Oh,
Cause,
internal bleeding.
bleeding bleeding in school in school
Skull.
to damage the brain. So when the more bleeding taken, the more dangerous in damage brain.
Yes, that's right. It's really dangerous, especially if the skull is cracked.
Yeah.
Skull is cracked. This one.
No, cracked, but the skull is not cracked, but the vein in brain, the mass of the vein in brain is broke.
Oh.
So bleeding many blood in brain and blood in demos the brain.
Yes, blood should not enter the brain.
Yeah.
Yeah, that's it. Okay. Now let's go to this one. How do you assess post-traumatic amnesia and why is it significant? Okay, let's go to this question.
The blood can high pressure in internal.
Yes.
In brain.
Yes.
Oh.
Yes.
Yes.
Okay.
So, loss conscious.
Oh, that's really terrible if that will happen. Okay, so let's now go to the next question. The question here is, how do you assess post-traumatic amnesia and why is it significant?
Amnesia post-traumatic amnesia is a complication of a head injury. The person is not is is can't remember.
Yes.
Can't remember. In several times. Lost memory. Yes. Lost memory. Temporal and this condition could is temporary, not only yes, temporary.
Yeah. Oh, yes.
Yeah.
Temporary loss of
memory. Yeah. But yes. Dangerously he could a lot of confusion.
Oh, confusion.
Yes.
Yes, that's
confusion.
Confusion. Yes. Okay.
Omit and lost vision.
Oh, yes. Confusion. That's really if that will happen, it will really lead to death.
If the school fracture, the doctor can fetch X-ray, school X-rays or CT X-ray.
Oh, okay. They can also do this, I guess. CT scan.
CT scanner. School CT scanner.
Oh, yeah. Okay. Now let's. Okay. So, the next question, Doc, that I prepared for this one is, what question should you ask to evaluate for a possible skull fracture?
Oh, the doctor can some question. The person has the person the person has headache. He is do his vomit, do his nestive.
Vomit,
Yes, vomit. Yes, vomit. Headache. Lost vision. Yeah.
headache, and
Lost
loss
vision.
vision.
Yes. He can he do he can he or she yes move hand and leg.
If can move the limbs.
Limbs. Yes. Yes.
Mm,
With the limbs.
limbs. Yes. Okay, so let us now
Yes.
go to, oh, yes, Doc?
Does he pain does he hurt anything, any organ?
Mm,
Yes. In the face, in the chest, or in the leg, in the limb.
oh, okay,
Anything.
so, yes, including the chest. Okay, thank you very much, Doc. Now let us go to, maybe this will be my last question. This one, why is it important to ask about anticoagulant used in a
Oh,
patient with head trauma?
the person with with uh, um, with heart disease,
Hmm?
cardiovascular disease, often anticoagulant. So
Cardiovascular disease.
yes, cardiovascular disease often use some anticoagulant drug,
Mm.
and the person can could have a could have a internal bleeding in school when
And yes,
yes yes school when he has injured in head injury.
when he or she
Yes,
has,
has head injured.
okay, could have anticoagulant use and could have an internal bleeding in the skull when he or she
She has in the head injury or in every organ.
had head injury. Okay,
Yes,
this
yes.
one. Okay, so we have 1 minute left, so I can just ask this one.
Bleeding is a dangerous complication of use anticoagulant drug.
Yes, anticoagulants usually are used to stop bleeding.
Yes, stop bleeding.
It's used to stop bleeding. Okay,
And stop anticoagulant drug.
yes, it's usually used for that. Okay, oh, and it is also usually used for this one, for blood clot.
Oh, the person with cardiovascular disease could still blood clot, but he or she could have bleeding.
Yeah, wow, that's really, wow.
Both of blood clot and bleeding.
Yes, okay. So thank you very much, Doc. Our lesson today is all about the eyes and the head injury. Next time, we will meet again and talk about the next topic. Thank you very much, Doc.
Thank you, teacher. See you.
Okay. Yes, good night. Bye-bye.
Bye.